Guys, well, we're going to step into our business spotlight with Member Medical, and we want to talk a little bit about the why behind who they are and why they were created in the first place and what need they originally came to solve. So, all right. So like we mentioned, our episode sponsor this week is Member Medical, and they're doing something a little bit different. Healthcare is something every single person watching deals with, and we wanted to give them time to really explain what they do because it's not what you're used to. So Phil and I are going to bring Jim, Owen, and Hannah on now for the first part of this, and then we'll come back to them a couple more times throughout the show. Jim Owen is the CEO and co-founder of Member Medical, and Hannah, say your last name for me. I don't want to butcher it.
It's Warren's House.
Warren's House. Okay, I knew I would have ruined that. So she is their office manager, both of you guys.
Well, thank you. We want to first thank Hardin Local for having us on today. We certainly appreciate that. So, we've been in business for 8 years, and I would say the vast majority of Hardin County doesn't know we exist. And that's our difficulty is we can't really say what we do in a 30-second ad or in a newspaper ad or anything along those lines because it is such a different approach to things. So again, appreciate us, who we are and what we try to do. And the why really comes down to, it was about 9 years ago, myself and my business partner, Brandon McKinney, were talking and we just realized health insurance was getting out of hand. And that was 9 years ago. And it's only increased and increased and increased since then. But we said there's got to be a solution out there for the patients, to the providers that are working to serve us and to get us healthier. And we were looking for options, and really the only option was we've got to unbuckle from insurance, who really dictates what your care is and how providers get paid. And they've got to run so many labs and do so many different things where it's no longer about you, the patient, or your care. It's about how many people they can see and how many they can process through. So I think that's the big difference. We really take it back to how do we give you the best care? How do we give you the type of access that you would want, right? You can get in same day or next day, or you can call, like you said, Rachel, any hours of the day to reach us. That's what we want to do. It's like having a relative that is a doctor or a provider in your family that you can call anytime, that they're going to give you the best possible answers for your best care. So we're really changing those things. And we also get into cost savings, which are significant. Again, we say the prices of everything keep going up. Phil, you had an experience that kind of had our paths cross to be on this call and what the crazy bills that you saw and what our simple costs are to do that. So that's just kind of the why that we put this together. I don't know if you all want to get into other details of whether it be Phil's situation or what you want to really discuss at this point.
Yeah, I think we kind of covered a couple of the first parts, and we're glad you're here, just so you know. Both of you guys, thanks for coming. And so tell us what led Member Medical to do things differently and specifically explain what exactly is direct primary care and how does it compare to a traditional doctor's office?
Yeah, so great question. So let's address the direct primary care and what that is basically, this is a movement that's occurring that has been around for a few years. It's bigger in some other states. Colorado, it's big, North Carolina, Texas, etc. But really, it is taking out all the middlemen in care, right? We don't bill insurance. We don't have to answer to insurance to get you the best care. We don't have to have insurance approve the medication that you go on if it's the best medication for you. We can utilize low-cost labs. I'll give you a good example. If we do a test and that test costs us, $2, but Healthcare Blue Book or the guidelines say we can charge $185, we're charging the $2. Whereas in traditional care, they're going to charge you the max, right? It's really about how do we generate the most revenue for whatever our entity is. Ours is different. We charge a membership. We charge that monthly, similar to a gym. And with that, all of your care is covered in that membership. If there's some extras, if there's some tests we do, if you need a brace or you need something along those lines, we're going to get those for you at cost.
Yeah, and that's great. I think you guys said you've been open for 8 years.
Yes.
And and there was we also discussed some skepticism. I'll review what happened to me. It was I was with my son over a weekend in the winter, and he had strep. I thought I had strep, so we just ran to like Norton's, just to get a couple tests done, strep and COVID test. And then, ended up after I got billed by insurance, I paid $400 out of pocket. And between his insurance and mine, we're already paying like $800 or more a month,
Right.
So it was just kind of crazy to me to think that, I can't even go someplace quick just to have something simple done without them just charging so much. And that's how we kind of got connected with you guys. Explain how your model is different, because I think it's a pretty big change for people, and there's probably skepticism out there. So maybe take a few minutes to explain why this could work instead of the traditional model.
And I'll stop dominating this and have Hannah come in here a little bit. But I basically, in looking at your bill that you posted on Facebook, they have all these additional charges, right? But you get $700 that insurance takes off. That's $700 that should never be in there in the first place, and you still paid $400 or what have you. And I think, like we talked after the membership for the COVID A and B test, for the strep test, all those things per person would be $40 through us, because that's our cost for those tests. So you can see the significant difference. And that's just a small example of something as simple as a strep, right? We're not even getting into if you need an MRI or greater care. And I don't know if there's anything you want to add to that part.
The model is different because with traditional healthcare, you're pretty much a number. So providers have a strict set number that they have to see a day. It could range anywhere from 30 to 40 patients a day. And when you have that time with your provider, it increases your outcomes. So you have better outcomes because your provider has a chance to get to know you. So for us, you're not just a number, you're a person. Like I know you because we get that time with you. The model is different because we take that time to get to know the individual, and it's not just your stats that's in your chart. So there's a lot of other things besides money that comes into play with our model.
One thing that I want to jump in here with is it almost feels like when I've gone to the doctor, it feels like it's a conveyor system. In, out, in, out. And it's like, I understand it to a certain point, but if I need to have questions, it's kind of hard. And then, hey, you got to show up at 12:15. I come in early. I don't get to the doctor until 12:30, 12:45.
Right.
So it's like, how is that different? How do you all address that?
So if your appointment's at noon, you're going to get seen at noon. We're going to take you. We have a waiting room, and a lot of patients think it's funny because when they come in, they don't wait in the waiting room normally. We take you straight back to a room, and you're immediately taken care of then. So your MA comes in and talks to you. You get to ask them any questions you want. They do your vitals. They do all that great stuff. After that, the provider has a full 30 to 45 minutes that they get to spend with you individually. That's not included in your MA time. So if the MA takes 15 minutes, then that's 15 minutes. If the provider takes 30 to 45, that's your visit. So you can ask all the questions that you want to ask. There's no limit, really. Like, we're not going to tell you, you can only talk about 2 concerns. It's just something you have the time with the patient that you don't traditionally have.
Yeah, Scott, I think that's one of the things we really try to present too. Our waiting room doesn't look like a normal doctor's office waiting room because, again, we don't have 10 people sitting in there, 15, and you come in for an ear rake and you're like, I'm going to come out worse than I came in because these people around me seem to be doing worse than I am. No, we're going to get you right back, and like you said, we try to stay away from any feel of you're part of the assembly line. Right. They pump you through, you go, we've all been there. You're waiting in the room with the door closed and you're like, oh, I hope they're shuffling my paperwork out there. So I'm next. It doesn't operate like that.
Which has truly been my experience. Just from walking in, they always greet me by name. And then I think one of the things that I loved is like a follow-up from my test. I get a personal phone call rather than like log into your app and see what your results are. And it's like I'm getting a personal phone call checking in on me and saying, hey, here's what the results are. We've sent everything in for you. So I'm truly just like a very catered, very patient, like they watch over, like she always is asking, like, let's look over everything while we're here, right? We haven't seen you in a while. So, all right, guys, well, hang tight. We're going to come right back to you in just a few minutes. We want to get into how it actually works and what the experience is like for the patients. But first, John O'Brien, we're going to jump into what's happening in Hardin County this All right, guys. Well, let's bring Jim and Hannah back in. So, guys, we know the why behind Member Medical. So now let's talk about what it actually looks like to be a patient and as a business owner. Jim, Hannah, welcome back.
Yeah, thank you. So I guess we'll address kind of who is this right for and how is it right for them. So the main thing to realize is we're not an insurance replacement. You know, people still need insurance for those catastrophic issues, car wreck, those types of things. We certainly think you need to have that. But what we see are the different types of groups that we're able to help, right? The individuals or families who just want better care for their family. And oftentimes what they'll do is say, okay, we're going to adjust our insurance, increase the deductible a bit, lower our premiums, add Member Medical to it. And they have a great opportunity to save quite a bit of money that year because, again, all of their maintenance care, all their primary care, urgent care, things are going to be handled through us. So they can save, like I said, quite a bit. They're not getting all those copays and insurance bills that you get. You're going through the norm. And the nice thing is you can be anywhere in the world. Rachel, as you said, you've called in on Saturday. You can be anywhere and we can address those concerns for you. That happens quite a bit, especially with spring break. We had quite a few calls from there where people didn't have to go sit in an urgent care on vacation and sit through that all day. So that's a nice thing for the individuals and families. The next step are kind of those businesses that, 10, 15 employees that said, gosh, we'd love to be able to provide insurance, but it's just too expensive for us to do that as a business. Oftentimes they'll offer us as an alternative, kind of here's where you can get some care, go out and get your own insurance, a high deductible plan, but we want to provide a benefit to our employees. Then there's what we call the fully insured businesses that have under 100 employees. And they offer the benefit of Member Medical to their employees because, one, they know they're getting better care. We're handling their occupational things. We're handling their work comp issues, that sort of thing. And then where we've really focused and why people maybe have not have heard of us over the 8 years, if they haven't worked for some of these larger companies, is we've kind of tackled those larger companies where they have 100 or plus employees and they pay for all of it, right? Other than the copay, they're paying if your bill, Phil, for your example, was $795, but you paid the $25 copay and the $40, what have you. They're covering the rest. So you can see where that would be a real benefit to them because they're acting as the insurance and they're having to cover all those costs that are now being covered by Blue Cross Blue Shield or what have you in your situation. So that's kind of how this works. Again, we would love to have more individuals involved, and we're trying to reach out to the individuals and a basis because we really think we can help those families. And as our community continues to grow, right, it's harder and harder to find that provider. In some of the research they've said, find your provider and find your veterinarian because they're going to be harder and harder to get into as we continue to increase in population.
Yeah, I think that's interesting. I know when we talked earlier before this, I said, so unlimited visits with no copays. I wonder what the catch is. And
yeah, so go ahead. I'm sorry.
And he said there's no catch. But
yeah, that's the hard thing, right? A lot of it is, okay, this sounds too good to be true. Even when we're presenting to companies, employees that have signed up, what's the catch? This isn't right. And I wish I could tell you we created some major algorithm or have some secret sauce, but it's really about our simplicity. Right? We've cut out all the people that are involved in your care other than the provider and you, the patient.
And you said that your membership rates are around $75 a month for adults and $40 a month for kids. So I wanted to ask Hannah, if I signed up as a member, walk me through what that actually looks like and what does a visit typically look like?
So when you sign up, it's $75 for an adult. You would come in for your first visit. Before your first visit, let's back up. Before that first visit, we would send you an email that had all of your new patient paperwork. It's completely HIPAA compliant. It goes right in your chart. So it all gets sent in before. The MA transfers everything over to your visit. When you walk in, you'll see a familiar face. It's always Miss Dina. She'll be there to greet you, and she'll get all of the added extra stuff that you normally do at a doctor's office. They'll take you right back, and the MA will do your vitals.
There's no waiting in the waiting
No
room?
waiting when you come in. No.
Usually.
Our providers have a schedule, and they stick pretty strongly to that schedule. We don't stack our patients, so you're never going to see a long wait line in there. Like, our providers are maxed out at 12 to 13 patients a day. So that's quite a bit of time they have for you.
Yeah. The traditional is 25 to 30 patients. We're at 10 to 50. And we don't ask, I think important, we don't ask for your insurance card or your credit card when you walk in either.
No. They'll ask for your insurance card just to have it on file, but we don't bill anything on it. So it's just it's a thing that we have to fill in for our EMR, but that's just because EMRs aren't necessarily made for direct primary cares.
Right.
So.
Okay. Well, that's great. Jim, you mentioned something I think a lot of business owners in our audience need to hear about: occupational health. Tell us about what Member Medical does on that side and how it saves businesses money on workers' comp.
Yeah. So when we're a part of an employer, if they're coming in for their pre-employment physicals, drug screenings, the pre-employment drug screenings, DOT physicals, all those types of things we're covering. Certainly pre-employment is no cost. The only thing on the DOT physicals and the drug screens is we just ask for the coverage of the cost of the tools used for the drug screen. And that's what? How much is that?
$10.
$10. So they're paying $10 to us to do that pre-employment or the DOT, or they're paying significantly more in our traditional care system. I'll also add on to the work comp thing. We've helped a company reduce their work comp by 88%. And if you look at the averages cost for these companies of work comps, you can look, and the numbers vary from $20,000 per case to $44,000 per case. So each one of those we reduce obviously may not be the $44,000 mark, but those are costs that are not hitting that company. So you can see where that adds up fairly quickly.
What about it? Do you have any stats on like how more, if some of if you guys have customers like a bigger business, have they tracked like how many less sick days they've had or anything like that?
Yeah, I think that's a great point, right? So when you go to traditional care, and as Scott was saying, right, he gets there at 12:15 and he doesn't know when he's going to get in. And if we're seeing you at 1, you're out by 1. Now that can be favorable for some people and not for others, right? You're leaving work, you may want that longer time, but we're going to condense that time down. And what we see to a better point on that, Phil, is what companies pay us. We're seeing anywhere from a 3 to 1 return on investment up to a 7 to 1 return on investment. So for every $1 they give us, they're getting $3 back or up to $7.
As a business owner myself, there's a lot of these companies that are spending a fortune on workman's comp. How do they sign up with you? What does it look like as a business owner to work with you guys directly?
Yeah, so we'll come in, and based on the numbers, there are some varied prices based on the number of people that we're signing up. But we'll come in, work with you, the business owner. You may hand us off to your HR or whatever that may be. Most of us business owners are also the HR, right? We're all of those hats. But we'll work with that, and we'll say, okay, what tools do you want to provide to your staff? Are we going to do the occupational health? Are we going to do the work comp? And just kind of lay those things out for you. Are we going to cover family members? Are we going to cover dependents? Whatever that may be. We'll establish that with you, the business owner, and then we'll come out and educate the staff on what we do. So we'll start to see utilization pick up. Again, as Phil mentioned, right, what's the catch? We have a little reluctance at first because, okay, this sounds too good to be true. But once people start coming in and they start sharing that with their fellow employees, we see utilization spike quite a bit. I will add one other part. A lot of people, well, I've had a provider, I've had them for 20 years, what have you. Do I have to change to you guys? No, you do not have to change. However, we see a large number of people do make that change because their current provider can't get them in. You're sick on a Monday and they say we can get you in on Thursday. Well, who wants to wait that long to get other care or better care? So you may end up in an urgent care or something along those lines. So we get them in same day, next day, they start coming back to us on a regular basis.
Cool. I think we're going to move on to Nate here. But what is the first step to a business owner that wants to start this process? Do they just get on your website and get your phone number, or just call, or what's the easiest way?
Just give our office a call. There's a place to sign up on the website, but we're very person to person. So if you want to give us a call, we think that's the best way to get started.
All right, that's good. We'll come back and finish up with you guys after Nate is done with
All right.
Business Buzz. All right.
All right, Nate, you ready to take us through what's happening in Hardin County?
I am.
Jim and Hannah back one more time. We've got
Before we bring them back real quick, I know that John and Nate probably are going to drop off. So good to see you guys. Thanks.
Good seeing you.
Thanks for being
I want
here.
to say one thing. I've been looking over this way. If you come downtown, there's a new traffic pattern around the square. Watch out for that. You've got to. It's more like a traditional roundabout now. You actually yield going in instead of yield to someone coming in. If that makes sense.
Oh, I do.
So-
I do have one quick one. That's a good one. Somebody told me about
Keep an
that.
eye out.
It's more of a roundabout than a traffic circle. I'll probably be avoiding downtown for a little bit, or just be coming the other way. There's a magic show Saturday night at John Hardin. I will be there. Aaron Hart is performing with master magician Lance Burton. Used to be in Lexington, or used to be in Las Vegas. I have a post about it on my page. I've been trying to help Aaron promote the show, but I will be there. Maybe I'll be a plant. Maybe I'll get caught on stage. I don't know. We will see. But I'm a big fan of magic. I've seen Piff a couple times, Blue Man, a couple of shows in Gatlinburg. So it's all, and tickets at the max, including all in, $15 for adults, $10 for kids. And it's obviously it's John Arden's pack where Scott Lucas has seen this kid perform like 74 times now. I'm pretty sure he has an office back there. It's a great place to watch a show. I've seen several shows out there. And so I will be out there. And if you want to go to my page or look up Aaron Hart Magic, there will be a magic show with a Las Vegas magician on Saturday at John.
Thank you. And see you guys later.
bye, guys. All right.
And before we switch back over, just want to let everybody know that we're going to have Rachel's housing update and also a couple short video reaction reviews with Britton of some food trucks after this last segment with the member medical.
Perfect. A couple of things, guys, that I want to directly focus on is access and like additional care that you guys make available to your members. So first of all, how in the world do you manage providing cell numbers? Like I've never been to a medical office and had them give me somebody that I could contact after hours. I mean, usually there's an emergency helpline, like when my kids are super, super sick and I'm like waiting on hold for someone to call me back. But like I have Christy and Sarah's personal cell numbers and I can contact them 24/7. That is wild. Tell us about how you make that possible.
So our providers have an app that's on their phone. It's HIPAA compliant. They have a number assigned to each provider. And so at your first initial visit, they're going to give you that cell phone number. They're going to say, hey, this is Christy. Thanks for letting me see you today. Here's my cell phone number. If you have any issues, just give me a call or a text. And so after hours, if you need anything, that cell phone number is there and you just reach out to them and they'll get back to you.
It's absolutely amazing. Now, I know the last time I was in there, I talked to them a little bit about like, you know, some of the MRIs that I need on a consistent basis due to just being watchful for, breast cancer and things. And Christy was able to connect me with a much more cost-effective approach. So tell us a little bit about those connections and how you've created additional options for your members.
Over the years, we've developed a few partnerships with local companies, small businesses, Heartland Imaging being one of them, and they do at-cost imaging for our patients. It's a lot lower than what you would see if you were to go to a traditional provider for those images. We also work alongside PC Pros. They offer a lot of options for us as far as physical therapy goes. Every now and then, if we have to call over there, they'll get them right in for us, and they work really well with us. We just call them, they say, come on over, or they'll find a way to get our patients in same day or next day as well. So it's pretty great. Heartland is too.
That's amazing.
It really is. The cell phone thing blows my mind.
Yeah, it's really easy and it's super, it's unbelievable.
Yeah, I will say we've had to tell people like, you wake up at 2 a.m. and you're like, oh, I forgot to fill my blood pressure medication. Just wait until the morning to make that call.
Yeah.
Because we've had those calls.
Yeah.
So if it's a real need, call in those after hours things. But no, we're happy to take those calls. And look, it's about giving you the best care you can get.
So is that because you're giving somebody a phone number? It almost sounds similar to like if I was going to call telehealth. How does it vary or different?
Yeah. So, what we call telehealth Dr. Roulette, right? When you do a traditional telehealth, you don't know who's going to be on the other end of that call.
True.
With this, as Rachel said, you'll either get Christy, Sarah, or Paula that's in our office that have a familiarity with you, and it's going to be somebody local. So it's not somebody across the country or across the world even trying to address your care that has no knowledge of your medical history or anything along those lines. So these are your traditional, your current caregiver giving you advice in off hours.
It's never going to be an after-hours service. Just like when you call us, it's never going to be a machine is the first thing that you hear. When you call a doctor's office, it's always like, press 1 for reception, press 2 for billing. It's a real person. One of us is picking up the phone and we're going to say, hey, how you doing? What can we do for you? It's never an after-hour service. We're all human.
Yeah.
That's cool. I got a question from my parents. Are your providers ND, NPRs, PAs?
Yeah, they're NPs with a medical director. We have Dr. Tom Hustad, who was the medical director at Baptist Health Hardin on our team. So he collaborates with the NPs, and we have some very experienced NPs.
That's great. Carrie Ann just said, love member medical, right? Yeah.
Thanks, Carrie.
And then and I think we had, also Gage said the member medical team is watching. Go ahead and Jim.
All right, no pressure.
Jim, you and your team, they're all local. You've built this practice right here in our community. I know you guys are still also involved in philanthropy. Can you tell us a little bit about that?
Yeah, we just try to support certainly those groups that support us and the different things we see as causes that benefit others in our community. And, we've got quite a bit of that, right? If you're a business owner, there's quite a few those charities out there that are constantly looking for that support. So we try to do that whenever we can and give back, and just we want to be a partner to the community, and certainly being from here allows us to do that.
Guys, I want you to tell us about your ribbon cutting tomorrow. I want to hear it from your words and go back over who's all going to be there, and I'm super excited to be in attendance. So,
well, Hannah's done all the work on this with the help of our team. Which we have a fantastic team, and they're watching. So I have to make sure I really stress how fantastic our team is. But I'm going to turn that over to let Hannah kind of express or address that.
Okay, so our ribbon cutting is tomorrow. It's from 11:30 to 2 at Member Medical, which is at 1230 Woodland Drive. The ribbon cutting is with the chamber, and it'll be at noon. So they'll be there with us. We have, let me make sure I get my list of food trucks because we don't want to forget anybody. We have Little Cheeser, Sam Gyros, Bluegrass Meats and Catering, Bustin' Bites, and Unbridled Grounds will all be there. Food trucks will be there real early, but we would like everybody to stop in and be at our ribbon cutting as well. The entire staff will be there. They're going to give tours and you'll get to see the facility. So if you want to see the patient rooms and you want to see the lab, and if you have any questions, everybody's going to be there, and our schedule's free tomorrow. So we're going to talk to everybody. You get to talk to the nurse practitioners, MA, receptionists. You get to talk to everybody. So we're available.
Yeah, the weather's going to be nice too. We requested that, and we'll see that as well. So
Here, there may be some prize drawings as well for if you tag I Love Member Medical while you're there.
Yes,
We'll have a few things to give out for prizes.
And did I hear that members get free lunch? Is that true?
Members do get free lunch. So you'll stop inside and you'll get a ticket with one of our staff. And it is open to the public. So if public would like to, if you're not a member and you want to hear about us and go grab lunch, you're more than welcome. But members get free lunch on us.
That's great. Before we let you all go, tell everyone watching one more time how they can learn, how they can learn or get signed up. And just so you guys know, on hardinlocal.com, I put all the links to their stuff. But just kind of wrap it up, Jim, for us.
Yeah, so definitely go to Hardin Local. You'll see our information there. Mm-hmm. We encourage you to give us a call. The number's 307-1980 is a good year. So 307-1980, just give us a call there. We're happy to help you in any way. Everybody's kind of got a different story or a different need. So having that conversation, they'll get you in touch with either myself or Gage or whomever as far as getting things set up. But I think our greatest strength is our team. It really is. We've got a fantastic team. Rachel, you've been there. You've seen them. They know you by name. That's something they really strive to do and making it a personal kind of thing.
I mean, we must be doing something right. We have our logo tattooed on one of our patients.
Yes.
So we're doing something right.
How did you know about that? I'm kidding. It's not me. But Jim and Hannah, thank you guys so much for joining us today. I am a very proud member medical member, and everywhere I go, like I was in my office the other day and one of the girls was like, "Oh, I got a sore throat. I'm a member medical." Like I very rarely recommend places because I'm always a bit nervous that people won't experience the same things I do. But I'm very proud to drop your name and push you guys. It's just a great, it's healthcare done the right way, in my opinion. So we are very proud to have you here in Hardin County. And thank you so much for your time and joining us. And I'll see you guys tomorrow.
All right.
All right. Thank you guys.
All right. Thanks.
Thank you, guys.
See ya.
Bye.
See ya.